My own personal technique for lipedema surgery is as such. To begin with, I do this in an accredited operating room. I do believe it is a surgery that needs to be done in not just a procedure room, but an accredited operating room that a patient is monitored in. I strongly prefer avoiding general anesthesia and do it in versions of local anesthesia. Two versions we'll talk about. The reasons I like to avoid general anesthesia are really three. Number one is safety. There is no comparison. It's definitely a safer approach under local anesthesia in a patient who's not completely unconscious. The recovery tends to be faster under local anesthesia with less bleeding, much more pure fat removal. Patients walk out usually half an hour after the surgery feeling very good. They are able to take a walk the next day and usually feeling quite good with things. But the main reason why I don't like general anesthesia is that liposuction is a very different type of surgery. It's not a cutting and sewing surgery. It is a sculpting and contouring procedure. And to me, being able to perfectly position the patient throughout the entire procedure is vitally important to getting the best result with the patient, not only in terms of removing the lipedema fat, but the best cosmetic results. So I offer it in two ways of doing it. Number one is what I do in about 85% of patients, which is very mild sedation with mildly sedating medications, Valium, and maybe small amounts of medications called fentanyl or Versed, where I am in essence acting as an anesthesiologist, giving some mild sedation, and then putting all the fluid in to the tissue with a device called wall that we'll talk about. The other way of doing it is with an anesthesiologist. And I can just tell you from years of doing this in thousands of patients that for the most part, it's not too uncomfortable doing it without an anesthesiologist. However, for patients that want to feel like they're feeling as little as possible and want to be less aware during the surgery itself, I offer doing it with an anesthesiologist in what's called twilight sedation, where he'll use more potent medications to take you into a deeper level of sedation for the first process while I'm putting the fluid in using the wall. And then what we will do is we'll lighten you up. So during the important part of contouring and sculpting to get a very precise result, you are able to move around in position. So again, two ways of doing it. Typically under mild sedation without an anesthesiologist, or with an anesthesiologist where you're put into twilight sedation. However, the choice of which way to go has to be done prior to the surgery. If we are doing it without an anesthesiologist and I'm doing the sedation of the patient, there's only so much sedating medications I'm going to be able to use without an anesthesiologist being there. And we are very good in terms of getting the patient through the procedure. If the patient starts to feel more discomfort, the first thing I'll do is slow the putting in of the fluid with the wall. The second thing that we'll do is give pain medications up to a certain point to help the patient through it. But a lot of this talking the patient through the procedure is almost like Lamaze, I guess, in childbirth, that there's a certain amount of discomfort that the patient will feel. It's usually not excruciating, the discomfort. I've never had to stop the surgery in the middle of it. We will always get the patient through the procedure and get the best result possible in each individual patient. But again, back to what I was saying is that the decision about whether to do anesthesia has to be made before the surgery.